broadcast. Okay. Oh, no, that's not what I wanted. Damn. Okay, good morning, everybody. Welcome to the webinar, which is looking at the COVID-19 reporting and the new requirements that have recently come out. I'm very chuffed to be joined by a couple of colleagues in the industry who are focused in on COVID and reporting and the health and safety of our staff and employees across the country. So joining us today is Kate Collier from Wentzel, as well as Karl Blom. And they will be speaking to the legal requirements with regards to the COVID-19 reporting. And then we're exceptionally excited to have Dr. Nisha Naicker from the NIOH joining us as well. And she has actually been integrally involved in the creation and setup of the new reporting requirements. So from a BPESA side, I also have my colleague Lynn Davies, who a lot of you interact with on a weekly basis for the BPESA reporting. There are two sets of reporting that obviously have to take place now. The one is still to BPESA as the trade body and industry association, which is the mandated reporting requirement that the Minister of the DTIC, Minister Patel, put out as a requirement for all call centers across the country to be allowed to operate specifically under level 1 and 2 when we were given essential and permitted service status. We're exceptionally grateful for this because we didn't see any job losses happening. Well, not that many job losses happening in our sector at that time. Quite the opposite, actually. We ended up seeing quite a bit of growth happening, where we were one of the few countries across the world that managed to literally keep the lights on and keep operating during this period of time because we'd lobbied and pushed so hard as the industry body with our partners, DTIC, and our social partner, Harambee, through to the presidency to ensure that we could actually continue operating at this time. Along with you, and I actually want to say thank you to you, we've traveled quite an intense journey. We've learned a lot about what works, what doesn't work. But the biggest thing that our sector and the GBS industry has really focused in on is a people-first approach, making sure that we're keeping our staff healthy and safe within our environments. So we're into this new world, this new normal that we keep referring to. And we want to make sure that we don't let our guard down and don't suddenly let the infection rate start rising and upsetting the works and losing all the traction that we've gained up until this time. So I know that there've been a lot of questions around the new NIOH reporting requirements that have been put out. And it was for this reason that we reached out and are really chuffed that we've got Wentzel to come and sit with us and speak us through the requirements of the do's and don'ts, how it works, and how you as an organization need to actually support the new national requirements of reporting on a weekly basis for any positive cases that come into your environment. So on that note, I'm going to pass over to Karl to pick things up and start speaking us through what the requirements are. Can I pass over to you, please, Karl?
Thank you, Tracy. I'm actually going to hand over first to Kate, who's a partner in our occupational health and safety team. And I think she will then handle the first part of the regulations, and then I'll come in a bit later to discuss the POPI and the data protection implications of the regulations and for employers as well.
Fantastic. Thank you very much. Over to you, Kate.
Super. Thanks, Karl. Thanks, Tracy. And good morning, everybody. Tracy, if we want to move to the first slide, we can start setting the scene as to just where the legislative framework comes from and why is that we're now grappling with both what we have to do practically and other legislative obligations that impact on how this can be done legally by employers. So as Karl mentioned, I will set the scene first in terms of how we got here from a legislative and regulatory perspective. So what are the statutory duties that are currently placed on employers? And I use the word currently because employers and the legislature and the regulatory departments, and I think we should be lauded for this, have had to adapt. And we've had to be in a position where we accept that we have to change our approach to legislation, our obligations placed on employers, and what we do in the workplace as we learn more about this disease, as we understand its transmission risks better, and as we understand our risk methodology. So at the moment, we know what we have to do, but my first legal caveat to all employers is that it's always important, but more so than previously, it's important to keep your finger on the pulse about legislative changes, because they can happen, they do happen, and it'll be important to keep your systems and risk mitigation strategies aligned with any new legislative obligations that may come in from time to time. Okay, Tracy, we can change the next slide. Right, so generally speaking, under occupational health and safety law, there is an existing obligation to share information with the regulators in the event of an occupational disease in the workplace. And we know that under the National Health Act, there is an obligation on medical practitioners and other relevant and responsible people to report communicable diseases to the Department of Health. And as we have managed and navigated our way through COVID-19, we're now in an environment where those two reporting obligations have become quite nicely meshed. And we understand the importance of having up-to-date and correct information, both in terms of understanding where we are to manage the pandemic, but also to make sure that we can track that data correctly in efforts to act on it, be proactive to limit further transmission down the road. So outside of your standard Occupational Health and Safety Act reporting obligations, we now have an additional layer of COVID-19 reporting. And how this sits from a regulatory framework perspective is that these additional obligations were required because your Occupational Health and Safety Act reporting ordinarily applies to the strict definition of occupational diseases. So diseases in the workplace that are caused because of hazards in the workplace. And we know that COVID-19, being a public health disease, is not caused because of being in the workplace. It may be spread in the workplace, but it would not be correct to indicate that the reason that someone may contract it is solely limited to the fact that they were performing certain types of work in the workplace. So through changes to the compensation fund, the legislature was able to expand the approach in respect of COVID, where it may have been considered to have been transmitted in the workplace, but while accepting that contracting of the disease is not necessarily simply because of being in the workplace. And that's an important distinction, and it indicates why there is a separate type of reporting channel to get the information to the relevant regulators as and when they need it. But don't forget about your OHSS Act reporting, because it remains just as important. We then have the OHSS directive, which sets out two types of information which have to be shared with regulators. The first mirrors what would ordinarily be expected of employers under the OHSS Act, and that is we have an incident in the workplace. Okay, accepting and caveating that this incident is not necessarily related solely to workplace risk, but we understand that we now have a positive employee at work. And there are obligations then on employers to report that both to the Department of Health and to the Department of Labor, who have individual and different obligations in respect to that information, and to the compensation fund, where it is believed that may have been transmitted in the workplace. In the most recent changes to the legislation, the net of other data and almost data that we can learn from and track and develop protocols to prevent transmission of the disease has been broadened. And where it was previously the remit of large employers who have over 500 employees, we're now requiring employers who have over 50 employees to share additional sets of data with the NIOH within the Department of Health. And really, we'll see as we talk through that type of data that is shared, the purpose is to enable our responding agencies to track and understand the risk in certain sectors, to track and understand whether or not the measures that are in place are suitable, and to understand how this disease may be evolving in a workplace setting. Tracy, we can move on to the next slide. Okay. So firstly, and I'm quite sure most employers are well now versed in these obligations. When you identify a COVID positive employee in the workplace, we inform the National Institute of Occupational Health, and that really is in line with the ordinary obligations to report compensatable diseases. We're informing the Compensation Commissioner in the event that there is an opportunity for that employee to obtain the compensation that may be payable. Employers have to investigate the potential mode of exposure and determine whether there may be a need for temporary closure, and to provide administrative support to the DOH. Practically, we can entirely understand why this is necessary. We have to understand as employers how it may be that there was a transmission in the workplace. This is not about fault finding, it's not about placing blame, it's about understanding, was this an employee who may have been identified at our symptom screening stage? So are we able to prevent a positive or ill employee from entering into the workplace where we can see demonstrably that that employee is ill? And this is overly complicated by the fact that we have increasing cases of employees who are asymptomatic, but yet test positive for COVID-19. But to the extent reasonably possible, employers should be implementing systems to stop that entry into the workplace as a first barrier. If that doesn't happen, and we need to know why that didn't happen, and there may be many reasonable reasons why that didn't occur, we then need to understand how it was transmitted between employees in a workplace. Is it because measures were not in place? Is it because our measures aren't sufficient? Or is it because employees were not complying with those measures? And those are all important from a remedial actions perspective. There may be a need for temporary closure. The reasons for that range from, do we need to clean any areas? Do we need to place a number of employees under precautionary quarantine? And if so, does that mean that we need to take a business decision not to operate? And most importantly, you know your people better than an external regulator. And if the regulator is going to be expected to properly contact trace, identify, and limit further community-based transmission, the employer needs to play ball and start sharing that level of information with the regulator. But these are not new. You should be doing these, you should be well versed in these, but really just a reminder that this level of reporting is as important as the so-called new stuff. Okay, Tracy. Okay. We then have the types of data that were being shared by our large employers and which we're now being asked to develop, curate and share across a far broader spectrum of employers. And the first is identifying vulnerable employees. You will all recall that from the very outset of the ability to return to work and the development of a workplace plan, employers were required to identify employees who were vulnerable. And there were a number of engagement and discussions about the definition of vulnerable employees. That has now been resolved through a very useful guideline issued by the Department of Health. And employers have to obtain that information from employees. Again, at first the question was, well, how do we get this information? Is it private medical information? Do employees have to tell us why they are vulnerable? And the regulations have now been cleared up in that the employer's policies have to require employees to provide this information, but they do not have to provide the reason why they may be considered vulnerable. They can if they want to, and there is a very defined list of what may render an employee to be considered as a vulnerable employee, but employers have to know who they are. And at first it was about retaining a list and making sure that there were special measures in place for them. And now that information needs to be shared with the NIOH. It's a once-off submission. So hopefully it's been done by everyone listening to this webinar today, but that doesn't mean that it can then be forgotten. To the extent that you are bringing in new teams, hiring new employees, changing your workforce, that list needs to be kept up to date. And that information needs to be shared with the NIOH when appropriate. The second type, again, is data that should be readily available. Employers have always had, from a COVID compliance perspective, an obligation to conduct symptom screening of employees on their entrance into the workplace. And given your sector protocols, symptom screening of employees during a shift, as you've had far more stringent assessment and monitoring protocols applied in your environment, in your sector, than others have who simply do it on arrival into the workplace. And where has that data been? How has it been recorded? How has it been stored? It should all be there. And it may just be a need for employers to realign how they are recording and what they are recording so that the information can be then properly captured and shared in terms of the guideline and how the NIOH needs it. And Nisha will be able to share with the webinar the practical reasons and types of information and how this should be shared later during this webinar. But really it's about sharing information of employees who are symptomatic. It acts as a wonderful mechanism for employers to demonstrate that their symptom screening is working, that the systems that are in place are working to halt a symptomatic employee from coming into the workplace. And again, the reason for that is not discriminatory, it's not apportioning blame to employees. It is identifying and isolating a potential case so that that employee can get the medical treatment and testing that they need, can be isolated to protect potential community and family transmission, and to halt the possible spread of the disease in the workplace, which not only protects your employees, but it ensures that as employers, you are complying with your statutory obligations. And there are very detailed time periods in which that information needs to be shared. We then need to share information about COVID-19 positive employees. Again, this is not new, it's just reframing the way in which this information is shared. What may be new is identifying and sharing the number of employees who are considered high-risk contacts in the workplace. The assessment always had to be done. You will recall in earlier iterations of the OHSS directive, in the event of a positive case in the workplace, the employer was required to conduct the assessment as to which employees may be considered high-risk contacts, and to then require those employees to quarantine and to use sick leave for that period of quarantine, whether they were symptomatic or not. This information now needs to be shared with the NIOH, and of course, objectively, would significantly bolster tracking, tracing, and understanding of the transmission risk within a particular sector and how that transmission may be influenced by workplace patterns and workplace setup. The fifth type of information that is being used to develop the understanding of the disease and where there is a legal obligation of employers is how is this managed when employees come back to work? What is the post-infection outcome of that employee? Are they back to work fairly soon following the wearing of a surgical mask rule? Was there a longer time period? If so, does the employer have to adapt its workplace to cater for that employee? And this will be informed by and dovetail from the standard Basic Conditions of Employment Act and other legislative guidance and obligations for ensuring workplace safety and ensuring that employees are treated fairly when they return from illness in the workplace. Okay. So what happens if we don't do this? Because much like we all have webinar fatigue, mask wearing fatigue, sanitizing fatigue, employers have data management and reporting fatigue. And we hear this often from our clients. Well, what can happen firstly is that you're probably not meeting your ethical obligations to ensure that you are self-monitoring and auditing your safety systems to make sure that they work. And you want to do that because a well workforce is a productive workforce. And there is both a legal, ethical, and financial imperative to make sure that we keep our employees safe. But from a pure statutory enforcement perspective, the OHSS Directive on COVID-19 measures specifically states that it would be enforced by Department of Employment and Labour inspectors in the same way and exercising the same functions that they have under the Occupational Health and Safety Act, which means that an inspector from the Department of Labour can come into your workplace at any reasonable time, request those documents, inspect those documents, uplift those documents, and ask questions to any person about those documents. If the inspector believes that there has been a failure to comply with those regulations, they may issue a compliance notice, the failure of which to comply with within the set period of time amounts to a criminal offence. Or if they reasonably believe that the failure to gather and act on this data either exposes employees to a risk to their health and safety itself, or whether this non-compliance is merely indicative of a general failure to comply with your statutory obligations, your workplace may be closed. Halt all operations, including the right to bar, barricade, and prohibit entry into that workplace, which would, of course, have an immediate impact on the ability to operate in the ordinary course, and has significant reputational impetus. We're seeing more and more press coverage of workplaces that have been closed under these provisions, and that's not something that any reasonable employer wants to have to deal with. And of course, most significantly, for employers and for their senior management teams and their chief executive officers who are personally responsible for ensuring that this happens, there is the risk of criminal sanction, and charges may be recommended to the NPA. Following an investigation, both the company and its senior officials may be prosecuted for failing to comply with this legislation. It seems heavy-handed if we look at a one-off potential breach, but there is a range of graduated sanctions, and where there has been repeat non-compliance, or where the non-compliance indicates a more systemic failure to comply, or indicates the fact that employees are knowingly being put at risk, there may well be the rationale to pursue a prosecution of employers for those breaches. Okay. It's important when understanding this reporting, and I suppose tempering the reporting and document fatigue that we're all feeling, in understanding why this is required. And I reiterate that this really isn't about a stick. It's not something that employers are then going to be necessarily monitored about later, and creating reputational recording systems about the number of employees who have had symptomatic employees in the workplace. But it is about enabling our regulatory authorities to properly respond to the changing risk profile of this disease, to make sure that they can properly manage it. Okay. Let's see. Okay. Nisha, can I ask you to come and talk to this slide? I mean, I know we have spoken about it in general across, from a legislative perspective, but just to give some practical input from the NIOH understanding of why this COVID-19 reporting has been expanded to larger employer groups, and by that I mean employers who have more than 50 employees, and just to give some practical understanding of why it is that we talk to these specific key types of information.
Okay, thanks, Kate. So the reporting, I mean, even though we are now in lockdown 1 and maybe people are more relaxed, but because the workforce is returning at such high numbers, it's very important that we continue this type of monitoring. And like the purpose of all surveillance systems, it's there to track and look at the trends of what's happening, to gather information on where the most number of cases are happening, which type of job profiles or job categories are more severely impacted, and where the hotspots in terms of the business sites are, and it's not necessarily meaning that it's because of the business, but it might be because of community exposure as well. So with this data that we are collecting, we'd be able to see where the high risk points are. We then would be able to advise on what type of interventions should be undertaken, or where interventions need to be improved. And post these interventions, we'd be able to monitor the changes and see if these interventions have had an impact. Also, the type of data that we are collecting, such as the return to work, we'd be able to see the number of employees, the average length of absence from work, and we'd be able to determine some sort of impact on the industry or the specific sectors or that business itself. So by collecting this data, we will be able to answer quite a number of questions, and also provide information to the Department of Health, Department of Employment and Labor, as well as the industries or the sectors itself. In addition, with this database, we will also be able to link with the compensation systems to be able to help them, because often there's lots of data that are missing that they need, and this surveillance system also complements their monitoring as well, or their compensation fund systems. So so those are the basic key reasons for the surveillance system and the importance of it. Also, like the last point you have there, the key scientific questions, we will be able to, based on what the findings are from this surveillance system, see what other questions come up, and do further investigations on those particular questions, whether it be in the industry, particular job categories, etc., and try to answer that. And the most important thing is to decrease the impact of COVID exposure and COVID infections on the business sector, which is critical for the running of the country itself. Yeah, so Kate, I don't know, I hope that answers the question.
Absolutely, thank you. It's always better to hear it from the people dealing with the information rather than the lawyers that are just interpreting the documents. Tracy, you can happy to move on to the next slide. Okay, I think I've spoken to this. It's nice infographic that your members can take away from them to see it. Then, okay, Nisha, this is back to you to talk. I know that there have been a number of questions that Tracy has shared with us just about how do we do this. We know we have to. We're happy to do it. There have perhaps been some teething problems in the practicalities of it, and I'm sure a lot of people would be really happy to hear you talk to the ins and outs of the why and how.
Okay. Yes. So we've also received many questions regarding this. So the first step is that I think the first thing to do is to read that National Department of Health guidelines, which explains the process a bit more than what's in the directive. So once reading those guidelines, you need to inform your employees about this whole process. So there's no need for direct written consent. Kate and Karl can speak to that, but the employees need to be informed that this type of information is going to be submitted. Then for the business itself, the first step is to register on the business portal. And after registration, your information is confirmed. So we confirm that that email address is working. The all the telephone number is working, because it's easy to make mistakes when you're typing stuff in. And once that's confirmed, you will then on that registration process, I should highlight, you need to state what type of platform you want to submit the data in, and that's usually causes a bit of confusion. So I'll just briefly explain it. The API means that you already have an app and you're collecting data in an app, and that app information can just be integrated into our system as long as the data points match ours. So you might need to tweak your app a bit. The CSV on Nextcloud is the most popular submission platform, and that is just using Excel spreadsheets, and those templates are found on our website. So you use those templates, fill in the data that are required, convert it to a CSV file, and you can just upload it. And the last one is the CMO, which is the app that's been developed by CSR, and it's configured for the system. So you choose that type, whatever platform you want, 1, 2, or 3, and then you register. Upon registration, you will get some sort of a confirmation that you have registered, and then in a day or two, from about next week, now we are dealing with a bit of a backlog, but in about 48 hours, you should receive, depending on the system you've chosen, instructions on how to submit, a link to the submission platform, a username and a password, and your business registration ID. And you will just use that information to log into that reporting platform and submit your data. So as I said, the API, which is an app, it's just a continuous flow of data from your system into ours. The CSV files is uploading these files on a weekly basis. So you end your week on that Saturday. So you have between Sunday and Tuesday to upload your files. And it's a simple process. It's just clicking upload and selecting your file, and it's there in the system, which you can also go to and review those files. So it's also is like sort of a storage base for you, and you are the only one that can access your folder on the CSV or the API or the CMO. So CMO is the app, and once you are connected with that app, you receive again your business ID, your username and password, and you complete the information for each employee. So whereas the CSV API can be bulk submission of data, with the CMO you have to type in the data for each employee individually. So yes. So I think I've gone above what's in your table here, but the submission process is quite simple once it's initiated, and it's, I should say, it's not very onerous, because you're doing the vulnerability submissions once off and just update. The symptoms is only for those employees that are symptomatic, so you could go a week or 2 weeks or maybe even more without any submissions. The positive cases and return to work only if there are positive cases and when they return to work. So the reporting can be quite, it's not every week that it occurs, and it's quite, we try to make it as simple as possible. Thanks, Kate.
Thanks, Nisha. Tracy, we can see what's coming up next. This is Karl's world, right? Karl, over to you.
Thanks, Kate. Thanks, Nisha. So Nisha made a very important point fairly early on in her presentation around consent of employees. And so we're now all aware that the Protection of Personal Information Act is in the process of coming into effect. For everyone's context, this is an act that's been in the pipeline for a number of years. And on 1 July this year, the president announced its commencement, which means we have a 12-month period to ensure compliance that will end 30 June next year. Now, notwithstanding there's this grace period, you'll see the regulations and the guidelines actually make it quite clear that employers are required to, 1, comply with POPI, and 2, notify employees that the information is being shared. Now, a lot of people ask us, well, do we require consent to use this information, to collect it, to share it? And there's often a bit of a misunderstanding of POPI that consent is required in all circumstances. And that's simply not the case. As an employer, as between the employer and the employee. An employer decides what information typically is collected from the employee. It controls that relationship as an employer. And that makes the employer what we call a responsible party under POPI. And as that name suggests, that means you're ultimately responsible as an employer for compliance with POPI as it pertains to your employee information. Now, in this case, clearly the state is dictating what information must be provided to the Department of Health. But that doesn't mean the employer stops being responsible for that information. So even though you're required to collect this information and that therefore you don't require consent because you're merely fulfilling a legal obligation that you have under the regulations, that doesn't mean you can simply put your hands up and say, POPI is not an issue for me, I don't have to comply. Rather, what you should be doing is communicating to your employees, and that there's no prescribed way in which you have to do this. I can speak for Weber Wentzel ourselves. We had an email sent to all staff explaining the regulations, setting out the relevant extracts, and just saying this information will be given to the Department of Health and to NIH and how it would work. So you just explain to your employees, we're taking this information because of these requirements under the Disaster Management Act. We're giving it to the department. Here's a link for your further information if you like. It can be that simple, but you do have to make sure that you are at least communicating this to your employees because they have a right to know what's happening with their information. And then as Kate and Nisha also said, if your employee refuses to provide that information, they don't have a lawful basis on which to do so. And as an employer, you can then block them from entering your premises. But that was a bit of a different rabbit hole. The other thing that then becomes important is you've now collected all this information from your employees. What are you required to do with this information? And really the goal is, and this is more practical advice, you don't want to keep information that you no longer are required by law to keep. So once you have fulfilled any obligation you may have under the Occupational Health and Safety Act or under the Disaster Management Act, and you are no longer required to keep this information, it's best not to keep it simply so you don't have to worry about continued compliance. But in the interim, while let's say you are holding information around employees of positive test cases, etc., you must treat the information very carefully. So practical tips, obviously, make sure very few people in your organization have access to that information. Only really those people who need to know that information, that any information that's paper-based is locked and sealed away, etc., that you have secure passwords in your email servers, etc. So that information is kept very secure, because if that information were, for example, to be leaked to your entire employee base, to take an example, if an employee has disclosed to the employer they're HIV positive, and that information is then accidentally disclosed to all the employees or to incorrect employees, you're still liable as an employer under POPI, notwithstanding that that information was ostensibly given to you as part of this contact tracing process. So just again to reiterate, you must communicate to employees what you'll be doing with the information. You must still take steps to make sure the information is kept safe. When you're longer required to keep it, we suggest that you delete that information fairly, as soon as you can. And as always, just treat this information as very confidential, very secure, because health information is, it's very protected under the Protection of Personal Information Act. And then finally, just to talk to the NIH's role here, of course, they themselves are also a responsible party under POPI. And you would have seen it in quite a few publications explaining how the NIH will use this data. And one of the things that the NIH will be doing is that they will be de-identifying the information. So what that means is that they will say, let's say they receive my name and ID number, and my employers disclose my comorbidity information with my ID number, and I've had a COVID test done and it come back as positive. So all these things can be linked to me. So what will happen is a unique identifier is created saying, and I don't want to speak incorrectly, so Nisha, please jump in if I'm speaking nonsense. But you can create a random identifier, and I will become A12345 on the system, and my name will be removed. And so that way, it's no longer on the system seen as Karl Blom is COVID positive and has these comorbidities, etc. It's rather that a person, theoretically, let's say a young adult male, has these symptoms, and you can no longer identify me back from that information. And once you have de-identified information in this way, POPI no longer applies to that information. And so that's the approach that the state has taken to, as much as they can, de-identify information, which then removes the POPI risk. And then if we jump to the next slide, Tracy, you'll see that where there is information that's no longer de-identified or isn't de-identified, the Disaster Management Act regulations are very clear that this information must be destroyed by the state within 6 weeks at the end of the state of emergency. But I believe in practice it actually happens a bit sooner as well. And similarly, this also applies to the contact tracing measures and other steps taken in conjunction with our mobile network operators, who have also been assisting the state in providing information for contact tracing based on cell phone numbers and locations of people close to other people that may be positive. So really, again, just to stress, the government's made it quite clear that this is a priority. I can speak personally from my engagement with the team that data security has been quite a key focus, and it's been something everyone's been mindful of along the way. But just to reiterate, just because the information is ultimately secured in the government end and may be de-identified, for that time that the information sits with you in transit almost, or sits with you as an employer and you keep this information, you must also be mindful that you yourself are responsible for the safekeeping of that information as well. And then I think that's really it from my side. We'll just change the slides, Tracy, to make sure. Yes, I think that's it for me. So then I think we can open the floor for questions.
And I'm on mute.
Yeah.
Thank you so much, Carl. Appreciate it. Excellent. Nisha, thank you. I see you've been answering some of the questions on the Q&A already. Carl, just while you're on, Warwick is asking with regards to the data, can the organization delete the reporting once an employee returns to work, or do they need to retain it for a period? I'm not sure.
So I'm going to pass it back to Kate quickly, but the general position on the POPI is that you are required to delete information you no longer need, unless you have a legitimate reason to use it for your business and you can link it to a clear purpose, or if you are required under any other law to retain that information. So I'm going to quickly pass it back to Kate just to set out those different types of data you may be required to keep under the Occupational Health and Safety Act, because it's quite a wide range of obligations there.
Thank you.
Thanks, Carl. Yes, you're quite correct. So every employer is going to need to carefully consider, in the context of their business and their risk assessments, whether or not the regulations dealing with hazardous biological agents in the workplace under the Occupational Health and Safety Act would apply. The general principle at the moment, given the guidelines issued by the Department of Labour in April this year, indicated that they are expecting all employers to comply with those regulations in respect of COVID-19. That position may well change, and we'll need to get guidance from the Department of Labour. Again, because those regulations are framed, and the intention of those regulations is to deal with biological hazardous agents that are in the workplace because of the work that you are doing, like labs, doctors, hospitals, etc. But it was the best way to quickly equip employers to deal with COVID-19 in April when this all started. But until we get guidance from the Department of Labour on this, and we have asked and flagged up this question, there is a need for employers to consider whether or not they fall within the scope of those regulations, and if so, whether or not their symptom screening forms part of their medical surveillance required under those regulations. And if so, you would have to follow the rules of all medical surveillance under the OHSS Act in the same way as you do for noise, lead, any other vibration, for example. And those medical records, where they form part of an employer's medical surveillance system, must be kept for 40 years.
Fantastic. Thank you very much, Kate. Okay, next question from Henrisa. What will the due date be for the new reporting to government? My understanding is it was 21 days after they were released. I'm not sure where we actually are on that now.
Yeah, I'm also, I don't have any definitive view on that. Nisha, do you happen to know?
Yes, it is 21 days, but because this process is new, I mean, we have just been, not sticking totally to that, and we asked if people are concerned, we do send an email to say that as long as they have registered, they have a bit of time before the submission can actually start, because they need the processes need to be in place. As long as they start the reporting date, or they send us reports from the 1st of October.
And then Nisha, just for absolute clarity, those reports would only be where there is a positive case.
Yes. So only for the symptomatic and positive cases, yes, if there has been any.
Perfect, thank you. Then Elizabeth, you've asked, on the vulnerable employees list, you only need vulnerable employees and not a full health report of all employees. That's correct. You don't need to put a full report up of all employees. It's only the vulnerable employees. And I think that Dr. Naicker actually responded to that of what details need to be submitted with regards to vulnerability. Elizabeth, can a company switch submission preferences at a later stage? Nisha?
Yes, you can. You just need to send us an email. So don't go and correct it on your registration page, but send us an email and we will switch it for you. Thanks.
Thank you. Okay, here's a technical one. Danella. Using the Nextcloud option, I see there's limited space allocated to each business for uploads. Is it required to delete all previous uploads and simply keep the most recent templates on folder, i.e. the last reporting week? Can you respond to that, Nisha? Do you know?
There is a limited space, but we can increase that space if it's run out already. So, I mean, it can, it's basically up to you. We extract that data like within 2 days, that data that you have submitted is extracted into the data lake. So those folders are for you, and you can delete the information in there or keep them, but we are able to increase the space for you as well.
Thank you so much. And then Nisha, I know you did respond to Warwick on this, but Kevin's also asked, must one report be submitted encompassing all locations, or must multiple reports be submitted per location? So maybe you just want to respond live so that everybody's aware when you have multiple location, what happens and how it works.
Well, we just require you to register the main head office. So where your head office is should be on the registration page. And using that business ID, you can either send it to your branches and they can use that and business ID and login details, and they can submit for themselves, or they can send it to you and you can do a central submission. So it's basically what is easiest for you, but your business itself just requires one ID. I hope that's clear.
Okay, Warwick, Kevin, if that's not clear, please do just ask again. We've had a number of questions coming through with regards to work at home employees. Do they also have to be reported on?
Well, the symptom screening does not have to be reported on, but because they are still working, even though working from home, I think they still need to be on that vulnerable list and positive cases, because we're not only looking at workplace exposures, we're also looking at any employee that has been contracted COVID itself, and this will then impact on the business, because once they have contracted COVID, they're not working anymore. And so we prefer to have that information as well.
Okay, I hope that's clear. Elizabeth, I see you've asked, what if a business already have more than one ID? That's not a clear question for me. Maybe you want to just add on to that and we'll come back to what you're asking there. And then Warwick's asking, what is considered close contacts with regards to face-to-face, and does that include when using masks or not? So I'm just going to take a stab here and then pass back to the panel. In the BPESA GBS Health and Safety Best Practice Protocol, which was pulled from the national regulations, close contact is exposure to an individual for more than 10 minutes within 1 meter. I'm not sure if that's with or without mask though, to be honest. So I'm not sure, Nisha, if you have a view on that.
Yeah, so we are looking at the high risk exposure in the workplace. So it is, if they are not wearing a mask, they are, for that specific time period, they are in contact and within that distance as well. So it's without a PPE of any type, then it's considered high risk.
Okay, I hope that that answers that for you, Warwick. Elizabeth, I haven't seen you adding anything on here, so I'm not sure, Nisha, if this makes sense to you. What if a business already has more than one ID?
It's usually, unless that business has registered under different names, because what will happen is they may have registered, and then those duplicate registrations will be excluded from the system itself. So unless each business has a different name, then it will be fine. But if it's the same name, have registered multiple times, after the cleaning process is done, the system will kick those additional IDs out. So if this is any of those problems are occurring, they can just send me an email directly and we'll sort it out.
Perfect. Thank you very much, Nisha. Then a couple of questions that Lynn and I have received outside of this forum. Lynn, if you want to pick up some of the questions that you have, so I'll just respond to one or two that we've received. There is a question of, are we now reporting twice? So I think I responded to that right in the beginning. The weekly reporting to BPESA sits under the mandate of the DTIC as specified by the minister when we were in level 1 and 2, allowing us to continue operations. And that reporting is done from an organizational level. Majority of participants on this call are already making use of that reporting submission, and we have co-created that with you. And I actually want to take this opportunity to say thank you to each and every one of you who are consistently reporting. It really makes things a lot easier, and I think you've all pretty much hopefully gotten used to it now, and it's become part of your Thursday routine. But we also obviously share the data afterwards once we've pulled it all together, so you can actually see where you're sitting with regards to, or in comparison to, the rest of the industry. So thank you for that. This reporting obviously is quite different, and it's really drilling down into individual cases, so hence the 2 levels of reporting. But one of the other questions that came out, and we did have this in our protocols, which are now being updated, is do you still have to send an email through to Department of Health and Department of Labor? And Nisha, I'm going to say here that we've removed that requirement to actually email Department of Health and Department of Labor, because submissions into the new system replaces that requirement. Would that be fair?
Yes, that will be correct, because Department of Health and Department of Labor will have access to the reports that we generate.
Fantastic. So as soon as we have sign off on the revised protocols, we will be sharing that with everyone. So that's that question. Lynn, what other questions?
Sorry,
did you
Tracy,
want
can I just jump in there on that?
Yes, please,
on that
Kate.
point? Just to caveat that by saying that in the event that you have a positive employee in the workplace, you do still need to comply with the separate reporting to the Department of Labor, who would then be considering whether or not they need to do a health and safety inspection in respect of the compliance. So there's the sharing of the data, which is done under one reporting system, but there is still the obligation to report to the Health and Safety Inspectorate under the original regulations.
Okay, that is important then. All right, because we did have 2 specific reporting email addresses, one which had regional addresses for Department of Labor, which our participants in our community have been reporting to or sending an email to, and one for Department of Health. But that email box, I think, is full because it literally keeps bouncing back.
I believe it is. I believe it is full. But until we hear otherwise, our discussions with the regional safety inspectors is that they are still tracking that information themselves, because if they are seeing that there are hotspots, they are using that to inform their general safety inspections and their compliance assessments.
Okay, that's important to note. So there we go. I'm going to backtrack on that then. So then if there is a positive case, organizations do still need to send an email through to your regional Department of Labor. Perfect. Thank you. Before I pass, yes, go for it.
Sorry, I just wanted to get that question in before I forget. If we can just get a broad view of the guidelines around the biometrics. People are quite concerned about the biometrics and the effects that that has on risk in the workplace. And if one of our panelists can just give us a short overview on how to deal and manage the biometrics. And then Tracy, I wasn't sure if the question about the multiple sites has been answered. I didn't hear any comment from them. Yes.
Yeah, multiple sites has. So Kate, do you want to respond to the COVID proofing, please?
Yes, sure. So one of the initial steps that was taken to mitigate the potential transmission risk in workplaces, and you'll recall, was an outright prohibition on the use of touch-based biometric solutions. That was then changed to say that you can use it. However, those systems must be COVID-proof where they are used. And what is COVID-proof has really been left up to, I suppose, risk assessments and technical expertise from time to time. And it depends who you speak to as to what is COVID-proof. You know, we've spoken to some engineering firms who are consulting with businesses whose view is that if you are touching it, it is not COVID-proof. We've also spoken to inspectors, particularly in the mining industry, who use biometrics frequently. And their view is that we have to take a purposive approach. And the purposive approach is we are preventing transmission. Transmission is through touching a potentially contaminated surface, such as your biometrics reader. And if there are systems in place which can be ensured, and that's really the key, it's you have to take steps over and above relying on employees to do it for themselves. So there must be a level of supervision or enforcement. But if you're covering all of those bases to make sure that, yes, an employee is touching a biometric reader, but immediately thereafter is able to completely sanitize their hands, either through washing with soap and water or with an appropriately spec'd sanitizer, well, then that risk is then mitigated. And if the employer is questioned on it, that system would need to be checked. The COVID proof would then talk to the system of how that biometric system is being used and whether it is being sanitized. But really, from a legal perspective, you're going to be, the question is, can an employee potentially transmit or contract COVID-19 from this process? And if we are making sure that there's sufficient sanitization occurring, you are likely to be able to demonstrate that you have reduced that risk significantly. I hope that assists from a legal perspective. I can't talk to the engineering specificity of it.
Thank you, Kate. And I think you've given a huge answer to that. I mean, in the current protocol that our sector uses from BPESA, literally specifies that the biometrics can now be switched on so long as it has been COVID proofed. And I think you've covered that sufficiently. So I'm watching time. Lynn, I think you had another question you wanted to raise, and then I'll read off the last two questions that have come up on Q&A.
Tracy, the other one was around the multiple sites, but that one has been answered.
Perfect.
So
Thank
I see
you.
that Nico and Euphemia have two questions.
Yes. So Nico is asking if there's aggressive testing, as in a positive aggressive testing, constant testing of employees in the workplace, and do you need to report on them as symptomatic if the tests are negative? I'm not sure I actually understand the question, Nico. If symptomatic employees are tested aggressively by the employer, do you need to report on them as symptomatic if the tests are negative? Maybe just add something else in, because I'm a bit confused on that one, if you don't mind, Nico, sorry. And then Euphemia, you've asked, it seems as if the same information must be submitted to the same parties in numerous forms and increasing frequency. How does this relate to the minimum, I couldn't even say the word, minimality principle of POPI? Karl, you've obviously read the question. Do you want to respond?
I think that's a great question, Euphemia. So really, the principle under POPI, as you've addressed it there, is that you shouldn't use any more information when you need to fulfill a purpose. Now, one of the purposes for which you may require, or you may process personal information under POPI is to comply with the terms of applicable laws, among others. So in the typical case, if you were, let's say, running for your purpose of running your business, you would need to get the full list of ID numbers of all your employees, extended families, aunts and uncles and things, because clearly that's so far beyond the scope of what they need to give you to be an employee. But in this case, where you're required by law or by the rules of profession or industry body, etc., to give information, and you're giving only the information required under those rules, under that law, then you're okay, because you're really just doing what you're required to do by law in any event. So it doesn't really apply. Where you would get caught up is if you were going beyond, so let's say the government changed requirements to say you must measure everyone's height in addition to these other symptoms and enter your building, and then you voluntarily started to record their weight as well. That would be an instance where you've now gone beyond what you're required to do by law and you're now exceeding the scope of that. But if you're just fulfilling your legal requirement, then you don't need to be concerned about minimality, because you are actually on track and just following the terms of law.
Thank you very much, Karl. I'm going to practice the word. Naicker, thank you for the additional information. So Nisha, I'm going to ask you, Naicker saying that if there are respiratory symptoms, for example, during screening, however, the COVID test comes back negative, do they need to report on them as symptomatic, even though those tests are negative? Thanks for the clarity, Naicker.
Well, ideally you would, because you, at the time of the symptoms, you would not have had the test as yet. So unless they are tested and then come to work and are symptomatic, I don't think that even would work. So I would say you would report them, and that will just be submitted. We are able to pick up if that symptomatic person had a positive test, because you're going to send the positive test. So if there was no test result, we will know that that symptoms were probably due to a minor upper respiratory illness, like a cold or flu. So
fantastic.
submitted.
Thank you, Nisha. I see we're on the hour, so I know that there are some more questions that Lynn and I have been sort of emailed or whatever. So what we'll do, please do keep communicating with us. Thankfully, we have a phenomenal team that we're able to bounce questions backwards and forwards to. But thank you very much for joining us today. I hope it's been insightful, and we are available should there be any other queries. And look after yourselves, stay well, stay safe, and have a fantastic weekend. Thank you very much, everybody.
Thank you, everyone.
Cheers, everyone. Have a great day.
Thanks. Bye.